Former New York Governor Andrew Cuomo appeared on Capitol Hill yesterday and spent the afternoon behind closed doors testifying on his handling of the COVID-19 pandemic and specifically nursing homes, how that issue was handled. The GOP issued a subpoena in March for Cuomo, calling on him to testify and answer accusations about underreporting the number of deaths in nursing homes in 2020. Possibly due to his own COVID policies of sending sick people back to the nursing homes. Here he was speaking with reporters before this deposition.
Do you regret or have any remorse that you want to share with the families today about what happened 4 years ago?
Guys, come on, don't crowd them.
Good morning to all of you. Today is an opportunity to actually get the truth and the facts out, and I welcome that opportunity. You know, 4 years ago, the Republican administration accused New York and other Democratic states of mismanaging the COVID situation, specifically mismanaging it in nursing homes. And they called for a Department of Justice investigation against just 4 Democratic states. Investigations found that New York followed the federal guidance that was established.
Here's an excerpt from his opening statement. Quote, "The factual picture today is much different than the accusations made 4 years ago. According to data from the CMS, by the end of 2020, New York was number 39 in terms of pro rata nursing home deaths. This despite New York being ground zero for COVID. Any legitimate review of what went on in nursing homes would start with the question of why a dozen states had nearly identical admissions policies, all issued around the same time. Why is it that only 4 states, all Democratic, were investigated by Trump's DOJ?"
To which I say, fine, investigate them all, but there is just clear evidence of wrongdoing here. So what happened is, Cuomo issued a executive order that nursing homes had in I believe March in 2020 as the pandemic was getting underway. The nursing homes had to take back people who were COVID positive if they were discharged from the hospital, and because of how wildly COVID spread in conditions where there are old people, it's at greatest risk to the elderly, there was widespread death as a result, and then the numbers of deaths were underreported by like 80% in order for his book to do better. His book on his handling of the pandemic.
Well, it's the classic case of juking the stats,
right?
And the idea that rather than being transparent about data and allowing them, because all the government data that comes out is then analyzed and used by scientists, by those trying to do rapid response, people figuring out funding, actually shifted how in New York State the most targeted population, the elderly, right, the ones who are in homes not living with their families, they were put at even more risk because of why. Now, I'm not going to say that it was because of a book or what other ambitions, but right. It is just this doesn't help people trust the science. This doesn't help people trust in government anymore. But this committee, in calling in Andrew Cuomo for something that we already know happened, was widely reported happened. Yeah. Who is he now that the congressional committee wants to interview him and make this a public issue again? Like, is there a sense that Republicans benefit by bringing COVID back into the discourse? Like, that was Trump. This was all under the Trump administration, all of the craziness and the back and forth of who was at a press conference and what information was coming out of CDC and are we going to inject bleach into our veins next? So no. I'm not understanding the political logic of this committee right now.
I mean, he's a free man still. That's a question a lot of people have. And his claim that he was just following the federal guidance is false. It has been rated false by PolitiFact because the federal guidance was that the nursing homes should take back the COVID patients if they can follow infection control procedures.
And
not
as we
just
know,
any
most
old
nursing homes
cannot
were
obviously
not
do that.
capable of this. I have
So
a friend-
obviously there was a lot of things we didn't get right in the early days of the pandemic or didn't understand how to do, but his policy was especially egregious. And then instead of just saying that, well, we didn't know, he covered up what happened. And yes, absolutely, other governors have done the same thing. I'm from Michigan. Jennifer Granholm's policies were exactly the same, and she has not faced nearly the level.
Okay, so this is right, but to that argument,
not Jennifer Granholm, excuse me, Gretchen Whitmer.
Yeah, Gretchen Whitmer. But to that
Granholm, previous
question,
governor, didn't mean to throw her under the bus. Gretchen Whitmer, same policies, has not faced.
To that question of why it's Democratic governors, right, who are being investigated, and as we said, more restrictive policies in Democratic states. But I mean, let's look at the governor of Florida. That entire state is full of seniors. Out having fun, partying. They just decided that they're going to have a medical director in the state who just decided not to believe in COVID anymore, right? So like
And
that,
their
you want to talk
outcomes were
about
no worse than anywhere else.
Significantly worse.
They were worse given the demographics of the state.
Well,
Yes.
Florida killed a lot more old people than other states did. Yes.
Well, it has a lot more old people. It has a lot of more old people
It's
there.
still right. It's the number of deaths. The fact that in all of this congressional hearing, congressional conversation, we've swept under the rug the actual fatalities and it's about look at who did what report and what numbers when, and we just have forgotten. It's like we've memory wiped how many people died as a result of the confusion and the lack of sensible, under Trump, consistent federal policy.
Well, there was no statistical difference between red and blue states on deaths until the vaccines rolled out.
I'm not talking about a red and blue.
I do agree with you that there was too much, but let me just say this point. I am not anti-vaccine. I don't think it should be required of people. And I certainly think old people and ill people should get vaccinated and boosted and all that. And there was maybe too much discouraging of that for vulnerable people on the right. That I agree with. But the mitigation efforts, the closing of parks and beaches, the lockdowns, the mask, all of that made very little difference. There's no statistical evidence it made any difference in the states that did it strictly and the states that said, let it rip, go ahead. There was no difference until the vaccine rolled out. And then, yes, the more vaccine hesitant among vulnerable populations did have a worse outcome at that point.
Right, so going after this as
that's
a
fine, but
red
the
or
first
blue
half of
issue, going after this as a red or blue issue doesn't get to the challenge of actually communicating about science and making sure the next go around, because there will be another go around, as we have a clearly interconnected global environment at this point, that we're in a better place to handle something like this. That's the partisanship about science that is just going to be devastating.
But I'm saying it's justified
to
because
us
the next
long-term.
time they say
So
6.3 people to a room, I'll say, where did you come up with that?
Well, we also are an average. What is it? We're average like 2.2 children. I mean, where's my 1/10 of a child walking around in the US?
Away from Fauci admitted that stay 6 feet away from other people was made up on the spot. He just admitted that in the hearing. So that's why people aren't going to believe it.
Listen, I was perfectly happy to use the excuse of, I guess I just don't have to socialize at cocktail parties anymore.
Oh, you're one of those.
Oh, well.
I like socializing.
I was pregnant.
I've never turned down a cocktail party in my life.
I will pass those on to you. I was pregnant during COVID, so a lot of this was really, really dramatic and intense. And I was talking to somebody, a reporter in South Korea, as I'm sitting here pregnant, trying to figure out what to do with my older child whose school just got shut down. And he tells me, he's like, oh yeah, I took my son to a baseball game. I'm like, what are you talking about? He's like, well, we've got micro-testing and micro-targeting here. Mm-hmm. So when someone gets COVID, we know what we have to close and what doesn't. And so mass outings like baseball games and schools didn't have to do that.
No.
Right? There were entire plans in place to get the Department of Defense to be able to turn over to production of PPE, of supporting tests and micro-targeting. That entire plan for an epidemic that is not only available online, but was sitting there and had been briefed to the Trump transition team was ignored because Jared Kushner was now going to be the health czar. And he had somebody he knew who could get the PPE to the federal government.
The people who screwed up early testing was the CDC, which it's continuous regardless of which administration in charge. They screwed up the testing because they said, nope, we're gonna make it illegal to have anyone make a test. We'll just make a test, and then the one they rolled out didn't work.
Here's what happened in my state, in the state of Maryland. Governor Larry Hogan, whose wife happens to be of South Korean descent, she's an immigrant, cut a deal to get $500,000 worth of tests from South Korea. Those tests, because of the transit time, ended up being unusable, that's totally useless. And that's that idea, right? This idea that going through business and going through corporate entities is the best way to solve a crisis, which is the Jared Kushner mindset, completely ignored the years and years of preparation that FEMA, Pentagon, everybody, all of the national security agencies had already done to address an epidemic. So I'm just saying, at some point, it is okay to trust massive processes that have been designed just for this moment.
I don't know if I agree with that, but I don't want to put Jared Kushner in charge of anything, nor does anyone on the right. So we can agree on that aspect of it. More Rising right after this.